at Markel Care with many years experience in the social care sector. So she's going to talk to us heavily around risk management, what you can do, some practical tips. Then I'm going to talk to you a little bit about insurance. I'm going to try and keep it not too technical, but talk to you about some specific practical angles, probably some burning questions you've got around pricing and cover. We do have to make some apologies. We were due to have Roger Booker on today to talk about some of the financial implications. Roger unfortunately couldn't make it today. However, I managed to interview him earlier in the week, and we've got a recording of that 15-20 minute slot. So when we send out the slides and recording, we will send you that session as well. So we haven't lost it. We just haven't got that for this particular session this afternoon. So our apologies. There will be an opportunity for questions at the end. Just from experience over webinars, it tends to work better if you could type those questions in, just so we don't get everyone talking over each other. So if you've got any burning questions as you go, please type them in the text box, which you should be able to see on the right-hand side of your screen. If you want those questions just to go to myself or just to Charlotte, you can select that, or you can put it to go to everyone. The choice is yours. So when we get to the final half hour, I'll whiz through those questions and we'll answer everything we can. Any questions we can't answer, we'll do a Q&A document. We'll make sure that comes back to you within the next couple of days. So yeah, Ollie, if you can just move on to the next slide for us. I'll just give you a real quick background for those of you who don't know myself and innovation. So we're a London-based insurance broker, very much focused around board level advice. As I said, I head up the Charity and Care division. And we really work in three main sectors. So we work with special schools, and we're affiliated with NAS. If you look in the top left there, the National Association of Special Schools. We work heavily in the domiciliary care sector, so you can see a couple of the examples there. And then we also work with a number of large charities. So there's a couple of examples there, Comic Relief, Prince's Trust, etc. So that picture's probably a little bit out of date for me. So pre-COVID, I did have some hair that seems to have gone now, probably never to be seen again. And then that's our Managing Director, Howard Pearson, I think should be on the Zoom and may well jump in at some point if we get any technical questions. So yeah, and that's just an example of our website. So as well as this particular webinar, there's a lot of content we put on there on a regular basis. So we'll share the web link at a later date, because there's some pretty good videos on there and some practical advice, risk assessments, etc. that you might find useful. Cool. Ollie, if you just move to the next one for us. So I'm just going to take a couple of minutes just to give you a bit of preamble and talk about why we're here today. So you probably get inundated with emails, lots of facts and figures, and you think, what the hell's going on? So I've picked out some specific charts and slides that I think are pertinent and have come from reliable sources. And the use reliable source, I think, is a key word there. So this is one that came out yesterday, that I saw yesterday. So this is talking about the rise in confirmed cases and the rise since we've had mass testing. So as you can see, some would say we're already in a second phase, others would say it's very near upon. So this is sort of giving you some figures in terms of the 7-day average. We're back up to the numbers that were back in June. So it gives some sort of facts behind why the government are doing what they're doing. Ollie, if you just move on to the next one for us. This one here just talks about post-lockdown, what the numbers are like. So a lot of people have been talking about shops have reopened, pubs and restaurants have been open. Boris kindly gave us our Monday, Tuesday, Wednesday meals out half price or 50% off. So we have seen a spike since then, and those figures have got a direct correlation with the younger people in the population, as you can see from this particular graph. If we move on to the next slide, Ollie. These next two are really pertinent, I thought. So this one here, this is one that's often has been shown in the press, which is a bit of scaremongering, shows you the sharp increase in the number of confirmed coronavirus cases since June. But then if we go to the next slide and we overlay that in terms of confirmed cases against the percentage of tests carried out, i.e. there's a lot more tests carried out now than there was back in June, actually there's a trend of reduction in terms of a percentage. So it's quite interesting there, I thought, that the media have been portraying there's a huge increase in spike, but they're kind of missing out some of the key data there. So that particular slide I thought was pretty pertinent. And this has come from the government website, so it should be a reliable source, he says. And if we just move on to the next one, then Ollie. So as a result of those sort of recent spike, you probably all have seen the new government initiative as of Monday, where social gatherings in England are going to reduce to 6. So if you look there on the right-hand side, Boris is saying we must act now to prevent a second lockdown. It feels to me like that's probably inevitable. There's going to be a second lockdown at some point. I'm sure most of you guys would agree, hence why you're on this particular webinar. But if we go to the next one, Ollie, we can see here it's not very clear in terms of what you're allowed to do, what can't you do. It changes on a daily basis. And this is for something quite simple in terms of what we can do in public and who we can meet with our friends and family. So if we start thinking about what can we do in terms of what's expected for risk management, risk assessing your organisation, especially working in care, it's just a minefield. So hence why we're lucky to have Charlotte on today. Who's really going to get into some of the nitty gritty. And her slides have changed even as frequent as this morning because government guidelines are changing. So I will caveat that anything we're talking about today is up to date up until today, but it is an ever changing feast, unfortunately. Other things, we will send these slides out to everyone. So if you want to pinch and use some of these slides for your staff or board, you're more than welcome to. Ollie, if you just move on, great. This is another one that was fairly interesting. So I suppose some of the pessimist in me, actually, the number of hospital admissions, which I think should be the real figure we're looking at, is actually reduced heavily. So although the cases are rising, or the reported cases are rising, and the tests are increasing, actually the hospitalisation has dropped massively and there's not been a spike. So I thought that was quite an interesting figure. Those don't include Scotland, I must add, so this is only for England. But that was as of just over a week ago, so it's fairly recent statistics on that one as well. And then the next one, Ollie, the last one here, which this came from the National Statistics website, this breaks down as of, I think it was this week on the 8th, the number of deaths for each age bracket. So I know there's been a bit of a hoo-ha in the press recently around youngsters contracting COVID and passing away, but actually those figures don't really correlate at all. So I thought that was quite an interesting slide. It gave some interesting figures and might help you with some of your planning and show what's reasonable and where you want to dedicate your time and effort. I know we've got a bit of a broad spectrum on the webinar today. Some of you deal purely with elderly care, others work with youngsters in special care and everything in between. So we'll try and keep it as broad as possible, but if you've got any specific questions, please do shout. So yeah, Ollie, if you want to move on. So I'm just going to introduce you to Charlotte. So Charlotte works for Markel. Markel are one of the UK's leading care insurers. So they do provide cover to many of our clients and many of the charity and care sector. So Charlotte heads up the risk practice there. So she's not an underwriter. She's not going to be swayed by paying claims, etc. She's purely looking at this from a risk perspective. What can you do to improve your risk? So we're not going to be talking about insurance nitty gritty. We're going to leave that to the end for me to take that one, unfortunately. And Charlotte's going to talk to you about some of the practicalities and how you could mitigate your risk. When we get to my section, I'm going to talk to you a bit about how you can present your risk to underwriters. So Charlotte might want to close her ears at that point. So without further ado, I want to pass over to Charlotte and let her talk through. As I mentioned, if you've got any questions, please do use the sidebar and type those in. If I think it's appropriate, we'll butt in and ask them at the time. If not, we'll either do them at the end of the session or at the Q&A session at the end. Over to you, Charlotte.
Thanks, Jonathan. So just to explain who I am, what I do, what my background is. So I'm the practice manager for Markel Care Practitioners. We have about 30 practitioners across the UK who work across the sector. So that's health, social care, community, charities, education, who we support. So we have in total 10,000 clients. And we have been helping them all the way through the pandemic and prior to that. So the experience and some of the information I'm giving is what we've seen, what we've been doing with clients, and it's trying to give you a broad spectrum of what you can do as an organisation. As Jonathan said, we know that you're wide-ranging, so some things will not be relevant, some things will be relevant to you, some things you may be able to move and transition into your organisation. So it's just to really give you an overview, and I've written these slides specifically that they make sense when you take them away, so you can use them as a reference point to have those conversations around second wave. If you just flick to the first slide for me, Ollie. So obviously, I don't think I need to give you massive amounts of information on what's been happening over the last 3 months. Obviously, as Jonathan said, we've had to change our slides even as of what had happened yesterday. But one of the major things to bear in mind is, as Jonathan's statistics showed you, while there is an increase in positive testing, that is among the younger age groups. Now, whilst there isn't significant deaths being spiked, that's not to say that there hasn't been significant deaths, nor there isn't the potential for significant deaths on a second wave. Obviously, the issue is the more people who contract the COVID-19, then the more people potentially can transmit it. So those organisations, especially those of the under 25s, who've had relatively little government guidance, and we've worked with a lot of them in trying to translate guidance that is out there specifically for their service. Now you may be seeing that there will be more guidance in relation to positive testing, so do be prepared for that. While we don't know when the technical second wave will begin, and I'm sure most of you already know this, the NHS, as of 2 weeks ago, started training all its staff on second wave planning. So that is an idea of what our health service is prepping for. If you are associated with CCGs, local authority commissioning, which I'm sure a lot of you are, you may start to see a rollout of the governance and the meetings that local authorities have done previously. So we're going to look at specific topics, and I apologise if I haven't been inclusive enough, but please do ask questions. If I can't answer them now, I will get back to you, and Jonathan and I will prepare all those questions so you can see them. Ollie, if you just flick to the next one for me. So second wave planning. There are certain elements to second wave planning that we have found that really work, depending on what your organisation is, of course. If you're one of those organisations that have had to close, furlough, temporarily suspend significant amounts of services, change the whole essence in the way you work, then evaluating your initial response may be a limited practice. However, for elderly care, dom care, a lot of the frontline provisions, looking at what you did previously is really important. And having that critical eye and looking at lessons learned, that is a way to make that preparation for second wave planning. Being prepared as well, so being responsive to potential change. We don't know when second wave is going to happen. Like yesterday, Jonathan and me have been changing what we've been writing by the hour, but it is really important that you're prepared for change. And when I say we, I'm not talking about directors, governance, I'm also talking about supporting frontline workers who actually are reaching resilience issues, potential burnout issues, and looking after the staffing of your team. So that takes us on to the workforce issues. It's one thing that we have seen that people haven't always put as much money and time into. And that's not saying that none of us care for our workforce. It is the fact that the workforce has been so resilient through this difficult time. Funding, we've had lots of questions about funding. What can I spend my PPE grant on? And that's really important to look and review funding, contracts, tendering, moving forward, and looking what the true cost of a pandemic is. Guidance, and I'm saying guidance rather than government guidance. Yes, we've had lots of government guidance. For those of you who are elderly or dom care, I think there was a point where it changed 4 times in 1 week. So we've all been having to respond to that. But that's also professional guidance, association guidance, looking at things, whether it's the NSPCC, whether it's some of the bigger kind of players who've been providing lots of guidance, which gives you a better view of the sector. Risk assessment and review. If you haven't done a risk assessment yet, I wonder why, but it is really essential. And it's not just doing the risk assessments. We can all do the paper exercise, but it's actually looking at where we apply those. We're looking at policies, processes and training. This is a really critical time to get everything up to date. There is a liability element, which I'm sure Jonathan will go into on that. But policies and process, making sure your employees and your service users and your stakeholders all know what you're doing, and making that plan so it's not overwhelming for you as an organisation, your staff and your service users. And then we'll look at some of the danger points that we've seen coming up. And then I'll explain a little bit more about what we do as Markel care practitioners. So Ollie, if you flip onto the next one, we're going to start with evaluating your initial response. So I'm sure most of you will have been working away at the COVID response, whether it's sometime in March that started to come into play for you. I know we had some early risers who managed to get lockdown implemented very, very early and a strategic COVID response implemented. Some people have had to respond later due to the nature of their organisation. So we're going to be evaluating your initial response from a second wave perspective. So this is about looking back at what you did, how you can do it differently, areas for improvement, what worked and why it worked. While this is a massive job to do, this is really, really essential, and it will make your second wave planning so much more easier to implement, to plan for, and to get those communications out to who you need to. So obviously we've had furlough issues, ability to staff, the use of agency staffing. For some specific professions as well, there has been changes in professional vetting. So it's really important that we look at what the government did previously and also look at the potential for that to come back in. So do reevaluate critical staffing. Look at what percentage of staff. So I think a lot of people worked at a 20 to 40% critical mass. So i.e. that they were going to lose 20 to 40% of their staffing. That's a significant amount. In general, we found that this workforce was far more resilient. However, this is round two. If you look from March to now, our staff will be getting a lot more tired. So you need to up those levels when you're planning. Looking at cost analysis, and we will look more detailed into funding, contract reviews, looking at PPE per service users, per staff, and potential funding streams you can look into. It's really important that you look into your sector, have conversations with other people as to what they are doing. Governance and decision-making processes. Because of how the pandemic initially started, and I cannot fault anybody that we've worked with for their decision making, for the response, the rapid nature in which people were working to. However, one of the things is it is really important to back that up, to make sure you have process and policy. What happens when the worst happens and who makes those decisions? This is second wave. We need to be making decisions and we need to be clearly recording and be defendable on that decision making. Ensuring that policies, practice plans, health and safety are all up to date. We have a small reprieve before second wave will be fully enforced and the potential for lockdown. If you have offices, if you have sites, estates, make sure you're looking at your fire risk assessments until January. Make sure you're looking at your Legionella. Make sure you're looking at your Lola. Any of those critical mandatory health and safety checks you need to be doing now to get yourself ahead. Because you guarantee the one place that you didn't check is the one place that there'll be an accident incident. Changes and challenges to services, risk assessment, social distancing, the likelihood is that you will put this into place. Make sure that you look at different levels of being able to provide those. So what happens if we go back to 2 meters rather than 1 meter plus in England? While that's different in Wales and Scotland and Northern Ireland, it's really important to look how you can contract and expand some of the government guidance and those limitations that you're going to factor into. One of the key things that we looked at during the first wave as such was people phoning up saying, I don't know what to do. I haven't planned for this. One of the things across the sector that myself, Jonathan, and all of you probably know is we are all really good in emergency. That's one thing we do very well. We know what to do when it is the unknown. A lot of that is anxiety about not knowing what to do. So having clear governance is really, really important. So if you don't know what to do, what meeting is going to be held? What information do you need? How's that recorded? And how is that information then passed down to the front line? Those are critical, and you must have that as part of your second wave planning, even though you cannot ever prepare for everything. So there is no point trying to. What you know, you can prepare for. What you don't know, have a system. Also looking at formalised documents, what you can give, training on things, infection control responses, reporting procedures. What happens when we go wrong, and looking at the arrangements, that's include partnership agencies. I'm sure you would all have different experiences with social services and how they've responded. We know on a region by region basis, this is a real change. Critical incident reporting, making sure that you are recording when things that are not COVID related also occur. And also ensuring that if staff, service users, shareholders, the public have issues, have concerns, that there are procedures for that. They are also a tool that we have to respond to accidents and incidents. If you go on, Ollie. So I know that's a lot in your initial response, and obviously I prepared the slides so you can go through them at a later point. This is a bit of a whistle-stop tour. So looking at preparedness, I think Jonathan and me have used this diagram repeatedly over the last 6 months. This is looking at the difference between what an emergency response is, a crisis management plan, and business continuity. I think a lot of the local authorities were asking for your business continuity plans, and you will have been providing those. But it's really important that you can almost weaponize what you're about to do in your second wave planning as quickly as possible. That is your emergency response. So having a second wave plan is really, really important, because when it happens, you'll be able to implement it and then just tweak it. Thinking, well, we'll just go back to where we were, we may be in a different position. For example, if we're seeing heightened cases in the under 25s, that may be a very different response for your specific service than it was for a response where actually it was the over 50s that were mainly affected. So please don't rely on what you've done before, and make sure you do that critical analysis. Go on to the next one for me, Ollie. This is one of my bugbears, and I say this having been a manager for years, which probably most of you, either if you're not managing staff yourself, you'll be feeding back to people who are. It is so important to look after our workforce. And one thing that we have seen is that the workforce is resilient, that more people have been to work than we thought. However, we are still getting significant issues. And as that tiredness and resilience starts to fade, the second wave could have a serious impact on your staffing and your critical mass. One of the issues I wanted to raise here is something that we've seen quite a lot of, and it's the issue with 0-hour contracts. If you are an organisation that uses this, I would suggest you do a risk assessment and evaluation. We have seen, and this is specifically an example that happened in a care home, where staff refused to have testing. The reason they refused to have testing is because they were on 0-hour contracts, and they did not want to risk going on SSP. So this in itself presents a risk, and the client didn't know what to do. Obviously, this is about the informal side of being proactive, having those conversations with your staff. but also looking to see whether there are disciplinary measures, professional measures. What happens if people are actually coming in COVID positive? So these are really important considerations to undertake and to look from a critical perspective. Also, staff well-being, ensuring that you have a package around your staff. For example, I know organisations that put on yoga. We have organisations that made dedicated emails where staff could email their concerns. More regular supervision if you are supervising staff. Key elements put into supervision, actually asking about COVID and personal situations. Personal loss and professional loss. I've lost 2 colleagues now to COVID. It is a massive loss and it has a massive effect on the workforce. Looking at training, managing isolation again. We all have repeat offenders who are more likely to isolate and more regularly isolate. Promoting leave, if we do have a period now of a few weeks before we hit into a second wave, look at getting respite for your staff. Promoting information and how we disseminate information to staff. I have seen massive strategic plans go out to frontline staff. This is massively overwhelming. We need to make this easy, bite-sized, and also do training. So staff not only know what to do because it's on a piece of paper, but we can also scenario test. We also need to think about suspected infection, where staff are not following guidelines. So you need to have all those mechanisms in. For those who have worked through the COVID period, you probably will have experienced this already. For those who are returning to work now, so your day services, some of the schools that didn't open before, those will need to be scenario tests and you need to have those discussions. So this is a massive one for me because if our workforce goes down, so does our service. And it's really key that we do invest. And I'm not saying that anybody isn't, but please don't forget this when there are lots of wider issues. And this is why I brought it to the forefront at the beginning. Moving further on to funding, if you flip over, Ollie. So PPE costs, this is the fun one. Jonathan and me have dealt with this one a couple of times. So the cost of PPE is extensive, especially for you guys, dom care, elderly. Of course, there was the issue for learning disabilities. You were a household, then you weren't a household, then you might have been a household. You didn't have to use PPE. And then I think overnight you had to. So we do know there are issues with PPE. You need to think about logistics. So don't just think of the raw cost of supply. Also think if you are a national organisation or you have regional hubs, how you can get PPE out to different services. That is really essential. And also have that risk assessment in place to consider what you do if you run out of PPE. What do you do if you have a PPE failure? It is still a cost to the business, even though it might be through liability. So you need to really look at what it costs per service user, what it is costing per member of staff. Why this is important? If you are a commissioned service, you need to be going and having a look at your contracts. You need to be having those difficult conversations with commissioners. One thing we have realised is that there is significant regional variation in grants and funding. Whether it's infection control funding, whether it's education and skills funding, and looking at what's there, you must know what's going on locally. And you must understand the terms and conditions of those funds. So do look at what you can charge. We know people who've charged back on staffing, who've looked at putting additional support in for staff. So really read and understand what you can use that money for. Pandemics are really expensive, so we found out, and it's really important that your service survives this. So looking at the cost analysis is also essential. If you haven't done this, start doing this now. Look at money saving projects. I know some people who went remote and have made the decision to stay doing a lot of remote work because it actually cuts down on cost. So it's really important to look at your funding. Initially, we thought this may be a 3-month thing. There may be a 6-month thing. The potential is we are going into 2021. You need to make sure that financially you can survive that. If there is an additional, you want to have a look at that, I can provide some links to information on that, and we'll put that through, Jonathan, at the end of this presentation. The next one is the worst one for me, and I've had so much fun. I don't think I have read as much in my entire career. Going on to government guidance, Ollie, if you could flick us over. I have read so much, and I'm presuming all of you have, and it's not easy, because what we're provided with from the government is somebody who doesn't understand the sector to some extent. This is not a how-to guide. This is broad strokes, and you have to work out as an organisation how you implement it. If there is one thing in relation to government guidance that you take away from today, government's guidance is a minimum, not a maximum. It is so important just for your own liability and the safety of your staff, your service users, that you consider government guidance. Please also don't just consider your sector. If you work with other agencies, please look at what they're being directed to do. There have been a lot of issues, and as somebody who used to be a senior manager for social services, I think I probably got away lightly by not being in it through this period. But certainly I know phone calls that have been made to safeguarding authorities that haven't been actioned and haven't been answered. It is really important that you understand what the processes are for those around you, for reporting, for notifications, for your regulators. As we know, CQHCA and Ofsted, they're acting in a slightly different way. And for those who are regulated services, I think some of you have really good relationships with your inspectors and received a lot of support. I know other organisations have felt very much left out in the cold and unsupported, and have been told you must abide by your regulations, but us as a regulator will stand back. So it's really important that you understand what everybody else is doing, and that feeds into your second wave planning. So you can, on the government websites, get alerts. They come straight to your phone. They come through all times of the day. Really important to get those. Make sure you have a really clear strategy of who is reading that guidance and who is going to disseminate that information. Consider what is relevant and ensure that you keep updated. We've had several issues with people using old guidance. If you are in a sector that doesn't have specific guidance, look at associations, look at your sector leaders, have discussions, join groups, and really have that critical analysis. Make sure you also keep up with professional bodies. I'm saying that for social workers, nurses, doctors, psychiatrists, OTs, the whole lot. Make sure you look to your professional bodies for the advice that they're giving. I'm going to see this one loud and clear. Disclaimers don't work. The reason I've stuck it in government guidance, because this came out when we were looking at shielding. We had a lot of providers that decided, as long as a member of staff signed a piece of paper to say that they didn't want to shield, it was okay. Please don't do this. It opens up you to a lot of potential issues. If there is a transmission, contraction, or death at work, you are going to fall seriously foul. So please be very, very careful from a staff point of view. Ensure that you are also up to date with the public guidance, because this is also changing regularly. Make sure that any of the changes that you are implementing as an organisation are reflected in policies. During the kind of first 3 months of the pandemic, we were advising that use an overarching strategy that details and lists your changes and what policies those are relevant to. At this point in the pandemic, all of those policies should have been updated. So do make sure you are undergoing regular review, and make sure that you are getting staff to sign they have seen and understand those policies, because that will protect you later on down the line. If you haven't, roll out COVID-19 training if you can, even if it's informally through supervisions, team meetings. It's a really, really important thing to do, and make sure it's recorded. Also seek advice, Public Health England, health authorities, local authorities, best practice. Another thing we also have advocated for is competencies. I will be passing some paperwork through Jonathan. We have done this once before, but using like medication competencies, even if you don't do medication, making sure that you have a competency if your staff are using PPE, really important. Ensuring that members of staff know how to do it, know how to put it on, that you're watching them and can tick it off. So if something goes wrong, you can say that they were trained and they were competent in its use. Governance guidance is a really tricky area and very time consuming, but you can get ahead of the game on this one. Flicking over to the next one, which is risk management. I don't think there'll be anybody here who hasn't done a risk assessment. If you've only done one, you are exceptionally lucky. Risk assessment, they are paper-based exercises generally, though we do dynamic risk assessments. Please do not use these as just a paper-based exercise. What we have seen is people doing risk assessments and just filing them. It is really important and best practice that you're analysing that information, that you're making decisions based on those risk assessments. Where you have large staffing amounts and you're doing regular risk assessment, it's important that you have some type of way of filtering your high level, your medium and your low. Using a RAG system, so red, amber, green, really good. Makes it really easier for anybody who's processing that data, and make sure there is clear decision making around what the risk assessment is for, what you do with it, and what the outcome is, whether it's for a service user, it's environmental, or it's for a staff member. It doesn't matter. Make sure you are not just doing it as a paper-based incident. Incident reporting, near misses, cross-referencing, again, very important. What we have seen, and I'm sure Jonathan will pick up on this on the insurance side of it, while we're under the pressures of COVID, there has been a notable delay in notifications, whether this being to regulators, to insurers. What has happened and what we've seen from that is where potentially we either could have got in early and supported, or we could have got in early and defended that claim. Now that has escalated to a point where it will be very difficult. It is really important that as we're looking at COVID-19, we're not taking our eye off other issues that we're well established and we have the knowledge to deal with. So it's about getting that balance in the second wave. Risk two from staff, from service users. Obviously, we have to look on this as an organisation by organisation basis. Risk from visitors. I remember when the visitors policy came out, it is a difficult one for anybody who's working with children, young people, learning disabilities. Contact with family members has been exceptionally difficult with really, really poor guidance. Just to make you aware, we have seen a load of local authorities say to organisations, yes, we have no problem. We want you to continue having contact. When I say contact, I mean, for example, if you are a children's home, you have a child on a care order, there will be a statutory obligation that that child has regular contact with their parents. There is a lot of risk issues in that. If that child is meeting that parent at the parent's house, there's potential for additional people to be there. There's potential for contraction. Then there's potential of the issues of coming back into a home. These are not easy to deal with. We've seen local authorities, I don't want to say shirking their responsibility and saying, you have to do it, but that's basically what's been happening. That push across to providers is placing you guys in the position of risk. You need to justify through really clear decision making and risk assessment why you have or haven't promoted that, and have that discussion back with the local authorities. We know this is difficult. We know this is a massively difficult area. And each service itself has a different level of being involved in contact. Obviously, we know that for care homes, we've had a lot of people coming in to say goodbye or final visits with people who have COVID. But visitors in general coming and going, you need to keep clear records. Even if we're looking at pubs now, and restaurants, they have to keep the details of anybody for 21 days. So really think about what it means and how the track and trace works and how you form part of that system. Obviously, continuity planning, quite happily talk about that outside of here, but continuity planning and those documents should be something you have up to date. If you haven't updated them, gentle nudge to do so, but certainly something you want to do. Use and supply of PPE. The chances are, if the government guidance changes heavily on PPE, there is a potential for another shortage. Please do consider the potential to have hubs and to also oversupply, and whether you can fiscally do that. So all these things that I talk about and all the different headings all intersect, and it's important that you look at them as a totally comprehensive plan. Risk of change, uncertainty and inaction. Again, this relates to managers, the workforce. Change is very unnerving. The first wave, we so much didn't know what was going to happen, and we responded, as the sector does. Now we have a better idea. You may see a lot more anxiousness. You may see a lot more signs of stress within the workforce. When I say workforce, that includes CEOs, managers, the whole lot, trustees. Please consider how you deal with that. It is really important that your decision making has a really clear process, but you also look after the well-being of your entire workforce. So risk management is complex, and there are going to be risk assessment laws. So let's get back onto the policy, the practice, and the training that you need to do. Ollie, if you flick to the next one, please. So policy, practice, and training. My general rules are you need a policy to tell you how to do what you're going to do. You then need a process which clearly explains that, and there's training around that. So if I'm asking a work member on how to do something in regards to infection control, I will have a policy that details that. I'm then going to do some training with that employee on how to do that. I'm also then going to ensure that there's a way of recording that, so that if something goes wrong, it's a flag up. So it's an incident, it's an accident, it's a near miss, or a lessons learned. Those three things are so important. If we miss one of them out, how does that staff member know what to do and what risks may potentially happen from it? We were working with some schools just coming up to the end of the summer term. And one of the things they were trying to implement was a plan to get around the school one ways. Sometimes it is better to stop, wait, look at how you do it, get the staff in, do the training, scenario test it, have conversations, look at where it isn't working, and then seek to improve that. Using something where people are going to find out on the day what is happening, the chances are there will be errors. I'm not saying that everything can wait, but you need to assess, is it something I need to do instantly, or is it more at risk through doing it instantly? Making sure that now, in this little gap between first and second wave, look at your training records. Have your staff done safeguarding training recently? Are they about to go out of date? Is the local authority doing that? Can you get a third-party provider in? Will anybody do it remotely? Restraints, if you use them, again, this was a common discussion through COVID. If you do use restraints, whether it be nappy, it be stitch, whatever. A lot of these organisations weren't doing the training, but they were providing updates specifically to clients so that you could manoeuvre it. The risk of a face mask, the risk of a shield, a risk of an apron to be used as a ligature in a restraint, those are all risk factors that need to be considered. So do go back to your training providers, do ask their advice. If you have in-house training, really have a review of where you're at. If you're a third party, go and have a look at what they're doing. Be prepared to ask those difficult questions. Again, ensure that your policies are updated. with any of the changes that you're planning to implement. Make sure staff have read them, understood, and signed that they have done that. That becomes really, really important down the line in respect of liability defence. Clear processes. Remember, we have a stressed workforce. It's really important to have simple, clear processes that people can look at. A lot of organisations, there's almost done a handbook for staff to say, these are all the changes, have these. And that's kept in the office so people can go and have a look at it. We've seen that really successfully implemented in schools that are coming back or have come back this September, where there's a little pack for each of the teachers, families, students that they can go and download or look at so they know what to do. So that can be supported through the teachers, through the staff, through the pupils and through their families. Policy, process and training. We're talking about infection control. We're talking about lots of other things. Please don't forget your health and safety. I've seen a couple of names that I recognised who are health and safety people. I am sure that you are on this, but please don't forget health and safety. It is so important. Make sure you are doing everything you can to make sure your environments, not just 1 metre plus, not just having one-way systems, but don't forget the underpinning regulatory positions that you still have to maintain, and ensure that you look at how you maintain those competencies. For example, looking at 2 of the domains that oversets here, visitors and doing fire risk assessments. Is it essential that you have a fire risk assessment? Are you using the building? What is the risk of a fire? That means an additional visitor coming to your premises. How do you negate that? So don't just look at things in isolation. Consider where you need to look at visitors to undertake health and safety checks. And also consider the long-term implications. If we go into a lockdown from October onwards, that will lead us to December, potentially to mid-January. What health and safety inspections do you need to have done by January? So you're planning ahead. And that's a key element to second wave planning. Let's look at how we actually pull this all together and make a plan. Ollie, if you slip onto the next one. Making a plan. So there's a lot that I've talked about in rapid succession. So apologies for throwing lots of information at you. I'm trying to provide kind of almost like a roadmap to what we've seen, where those danger points are. It's really important that you come up with your strategy, your governance plan. This may be a version 2 of what you came out with earlier in the year, or you may decide that certain things didn't work for you, and then you can add things in, but use this time. I'm not saying this is downtime. This is certainly a time for you as managers, directors, health and safety, practice, clinical, really need to get on top of what you are doing. It's important that you look at what you know as an organisation and you look at what you don't know. It's absolutely fine to say, we don't know how this bit is going to plan out, or we know that this may be one of 4 scenarios and this is what we are going to do in each of them. So really have that critical analysis. We have provided critical analysis training for some of our clients because it's something they haven't done before. So it's really ensuring that your management workforce, your directors, your trustees understand how to be critical. Not critical in saying you did badly last time, but critical in saying, how can we ensure this impacts the least moving forward? Decision-making trees, you know very well when we're dealing with a crisis, the one thing you want is a list of numbers of who you have to go when it's what. Really important to get that out to your front line. Make sure that it's on every company phone. Make sure it's easy access. If you do have people who are in the field, and I know a lot of people have worked in the field throughout, make sure that they do have access, because it's as somebody who's worked in the field myself, I know sitting in a car with no reception trying to get onto a policy website to find out who I had to contact, just make sure you send it out to everybody and they put it on their work mobile phones. Risk assessment, I won't say it again, I promise. Just make sure that you're looking at control and protective measures. That is absolutely essential. How can we control this risk? And is that an acceptable risk moving forward? Guidance, again, a lot of this is repeating because you do need to make sure that this plan comes together as a comprehensive unit. Making sure you really look at the workforce. How can we support them? How can we make sure that we can get through to next year? How can we make sure that we're not going to lose staff? How can we put that additional support around our staff, whether it be EAP, whether it be regular bingo nights, something that brings your workforce together. And I think probably Jonathan will have a few ideas that he can help you on that one. Also communicating clearly. And I say this, the amount of staff that we've seen just overwhelmed by the amount of information. And I can say that as somebody who's provided a lot of information today. There is so much, but we need to be really careful that as that comes down from the level of governance, that is really digestible, especially when you're dealing with service users and service users' families where there's communication issues and needs. We found some really difficult issues coming in, especially families from LD, behavioural, substance issues, where the risks are increasing. So do look at those elements about how you're communicating. And actually, if there is a slight change, does that need to be communicated on a daily basis with frontline workers? Or actually, can you talk in broad terms and then send that information exactly where it needs to go to the part of the service? Change, fear and anxiety, really do a risk assessment on this. Do pulse surveys, really good. Just take a survey of your staff on every 2 weeks, see how their mood and feeling is. It does help you to gauge, get feedback from RMs, from managers. All of these type of things really feed into how guys at the top and guys at the front can really know what's going on. That morale is essential as we move into the second wave. Review it and adjust it as required. Really think about, if I change this, what's the frontline impact and how do I get that? QA and QC, quality assurance and quality control. It's really important we still go back to the basic checks and countermeasures that we put in place before. I know there's only so many balls when you're juggling that you can hold in the air, but it is essential that those basic checks and measures continue in place. Environmental and building related issues, I think, you know, the health and safety guys out there, you are not forgotten. I've seen a couple of you come into the presentation today. Really, it is important that you're including health and safety in any of your governance plans. Also consider notifications and reporting arrangements. I know that Jonathan is going to go on to insurance, so I'm sure he'll give you some tips and tricks about that side of it. But it's really important that you get all those things together. Make sure that you are making notifications where real change and defensibility can be made, or you're making sure that you are not delaying it to the regulator, because the potential is that could lead to an early inspection. Obviously, inspectorates at the moment are only coming down and working with those most critical. But a couple of late notifications, you can find yourself being inspected, even if you have a good or an outstanding rating. Making sure that you look at the management of infection and suspected infection and what your process is around that. Really work with your HR teams to make sure you have clear lines for disciplinary. If you are doing in-house testing, what is your organizational policy? If you are part of a testing program, whether it's a 28-day one, what happens if somebody doesn't want to do it? Are you going to lose loads of staff? External visitors, statutory functions and non-statutory functions, really thinking about what you need to do, thinking about visitors, about contact, about parts of your services that are multi-agency and rely on partnership working. It really is important to have conversations with partnership agencies to understand what they're doing. That helps inform your plans. You are therefore proactive and not responsive, which if you go up to the wonderful little diagram I showed you at the top, we want to be in that proactive area. We want to be responsive when we need to be, but if we can be proactive, that's the best way forward. So I'm not here to scare anyone, but going on to danger points. this is really, really important. So this is some of the things that we've seen through the period, and some of the things we see repeatedly. And when I see these things repeatedly across the sector, I'm guessing that there are lots of people doing it. Responsive to change and the impact of change is really, really important. Sometimes it's really easy when we're at the top of the tree to go, right, well, we'll just change that. We don't see how that channels down, whether it's to service users as well. You may find if you continually change a way you do something in a home or as a provider, that this triggers more risk behavior from your service users. So not only to be responsive, but also consider the potential dangers and risks of change. And that's why being proactive is really good, because you can then slowly bring those changes in where you have the ability to do so. And that means that if we're changing this much, this is controlled change, this is reactionary change. If it's all reactionary change, it has a very big knock-on effect to the rest of our service. Updating the policies, processes, and training. Again, we've seen a lot of claims come in. We've seen where there have been surprise inspections. These have been issues that have been raised, and these have not been seen well by regulators or potential insurers. So if you haven't changed those things, really go and have a look at them. Even if it is, if you've got a 10-page policy on safeguarding and you need to make a change, add it on as a box at the bottom that people have to read. Think carefully about your time. I know that I'll be everybody sitting here listening to me talk, but your time is precious and we massively understand that. So you need to look at these little time-saving exercises that give you what you need but have minimal impact. Staff well-being and resilience. Again, I've had, and I'm going to use this as an example. We had an organisation where an employee tested positive for COVID. What wasn't realised at the time was that employee was also registered with 3 agencies. That employee was on a 0-hour contract. When they were put on SSP for the organisation, they actually went and worked for 3 different agencies as COVID positive. Significantly concerned. Was that individual's decision? Absolutely. But there's potential risks because of knock-on effects, both personally, professionally, financially, all of the above. So it's really, really important that we take a critical eye. Looking on the flip side of that, if you're an organisation which, to ensure that you have critical mass, are employing agency, what checks are being done? Is the agent doing that? Are you doing that? Even though we have had through COVID limited checks, so the checks that we would normally do have been crushed down and agreed through guidance, it's really important that you do what protects your staff and your service users. So do consider that in a very critical term about where and when you're getting your staff and potential complications. Staff competencies. Don't assume because you sent an email out on Tuesday that by Wednesday everybody's going to be doing what you've asked in the email. I'm sure we've all learned this on the hard way. It's really important that staff feel competent and confident, and competencies is a way of doing that. And we've seen massive changes in morale due to using staff competency. Yes, it is a bigger drain on a manager's time to sit there and do a check of, can you do this? Do you know how to put on a mask? Do you know when you report symptoms? Do you know what the process around that is? But actually, if a staff member feels really confident about that, you will have an instant alert system. And that assists you in managing your second wave. So those things are really important, and we will provide some information which Jonathan can send out. Communication. Again, we had one provider who sent out emails, I think virtually daily for 2 weeks, to have a bunch of staff going, I don't know which one I'm doing it to. It was so convoluted. We supported that organisation. They did a very comprehensive and dynamic COVID-19 strategy. And we actually supported them to create like almost an easy read version for their staff, and then something else for their service users. And yes, it takes time, but again, if you can get the service users, their families, the staff all working with you, you have a far better chance of managing a second wave. Recording decision making. We have seen a lot of governance panels where you're looking at numbers, you're making decisions about your organization happening, and there is no record keeping on them. They're making decisions and they are not taking minutes. Please ensure that your record keeping for decision making at whatever level is still recorded. It's really important. You will use it later, and when you come to evaluate first wave into second wave, you can look back and see why you made those decisions then. So they are pointing at those records. Risk assessment review, again, you can do a risk assessment. It doesn't mean it's going to be used, and it doesn't mean you're going to implement it. So ensure that your risk assessment process has a purpose, that you know what you're doing with that information, and that entire process is followed through. I have an organisation who'd maybe done 200 or 300 risk assessments and just put them in a file. They're done, but what's the purpose of them? So it's really important to think about why you are doing things. Guidance and practice, you know, I think all of you have dealt with the guidance issue and some of the issues that we've all faced due to that. It's important that you understand how that guidance relates to you. If you're unsure, have conversations. We've had a lot of people saying, this is how I've interpreted the guidance. Do remember there is a reason why guidance is coming out. And if you are deviating from that for whatever reason, you need to have that decision making. Delay and distraction. So while we're looking at COVID over here, we're not looking over here at business as usual. It's really important in second wave we manage to balance those two things. So do look at what you should be doing. Try and notice when there is delays, when things that should have been done and normally would have been done aren't being done, and have decision making and recording if you are going to delay that, i.e. be proactive. If your second wave plan is actually we do X monthly, but during a COVID period we're going to do it bi-monthly, go in with that. Do not delay it just based on the fact that you haven't had time to do it. It's far better to be prepared and have a risk analysis around them. No cross. Don't get cross with yourself. Don't get cross with yourself when things don't happen the way you think they're going to happen. Make sure that you've got the ability to be kind to yourself. It's really, really important. If we flick on to the next one, I'm going to be very quick with this. I'm going to leave this one with you because Jonathan, I think, is going to go into the reliability reduction side of it and look at some of the things we're going to do. So that's just to sit in there for looking at the potential for claims coming through and making sure you are defendable, making sure you have the ability to record, that you're doing things, you have processes and policies and training in place. So most of this we've gone through above. And if we go to the next one, just to give you an idea of what it is I do and why I've been saying the things I have. So we have over 30 associates across the UK who've been working through the COVID period. We are a health and social care consultancy. We have only managers and above. We have different levels of expertise, from anything from commissioning right through to nursing, to people who are nurse practitioners for learning disabilities, social workers, registered managers, housing. So we've acquired the knowledge that has come into this presentation through working in the sector throughout COVID. And a lot of what I've been saying repeatedly is stuff that's come into us. We've made sure we are across adults and we are across children. And we do understand that both elements, if we do use that as a subdivide, which I know isn't the only one, but both of those areas have had a really different experience of COVID. Now we're seeing the numbers shift across, not the death rates, but transmission. There is likely to be different focus. So if you are an organisation that's solely children's or solely adults, you may want to, it's really good to share, to do peer support. Make sure you share that information over with each other. Our policyholder services basically is what we do on a normal basis. I can tell you at the moment about 45% of what we've been doing has been continuity and second wave planning. Taking that up, we've probably done another 30%, which is literally just asking COVID related questions one by one. So that's kind of what we've been doing over the COVID period, with the rest of that being made up with specific training which has been written for our policyholders. So it gives you an idea of what we do and how much we do on an annual basis. I'll leave this next one up with you. This is the type of thing we do if anybody's interested. Obviously, you can contact us through Jonathan. You know, we are here to help. I have immense guilt for not being out in the sector specifically through this period. But actually, what we've found is that the sector has been very resilient, that you're all doing a massively amazing job. But I do think that the second wave is going to be a massively difficult period, and we're going to face more and different anxieties than we did when we were responding to something we didn't know. So hopefully that's giving you guys a little bit of an idea, and I'm sure Jonathan will have questions for me or for you guys. But I'll pass over to Jonathan. Thank you so much for your time.
Great, thank you very much, Charlotte. That was really interesting. So hopefully everyone can hear me now as well. So yeah, has anyone got any burning questions? I know Charlotte's gone through a very quick whistle-stop tour. I haven't seen any questions pop up yet. If you want a couple of minutes just to digest that and ask the questions at the end, please do. There's lots of things in there that Charlotte's gone through that we can probably offer a little bit of extra guidance. We're just conscious we wanted to give a broad idea on some of the risk management mechanisms you might want to consider, bearing in mind the audience today. What I'm going to go through now, I'm going to spend about 15-20 minutes just going through some of the insurance landscape. So many of you guys that are on this webinar now are existing clients of ours, and have probably already spoken to me around what the hell's going on in insurance, John? Is my premium going to go up? What's the differences in cover? Excuse me, everyone that's part of a trade association has probably been seeing lots of communications around that. So I'm going to give you a bit of an overview as to what's going on in the insurance world, and try and demystify some of the complications, and it will probably leave you with more questions than answers, and that's unfortunately because the landscape we're in. So Ollie, if you just want to move on to the next slide for me. So just to give you a bit of an idea as to where we're at, that current thought process is that in the insurance world, COVID is going to cost anywhere up to 200 billion. Numbers fluctuate between 45 and 200, but the 200 billion figure has been bounded around by numerous different sources. So although you might consider you as a particular risk very good, you might not have made a claim, you might have been pretty much business as usual as much as possible. However, the insurance industry as a whole is taking a massive, massive hit. And unfortunately, the way the insurance world works is that the claims of the masses are then paid by, the claims of the few are paid in premium by the masses. So unfortunately, that is the current situation we're in. And this is even before we consider a second wave. So just move on to the next slide, Ollie. I'm just going to talk to you a little bit specifically about charity and care. So all of you guys that are on, no matter which particular niche of charity and care you're in, or education, these are pretty much have been the mainstay and the main insurers that you would have worked with for your liability. There might be some slight variations if you've got some sort of nuances in what you do in terms of service delivery. The reason I put this slide up is actually that insurance market 6 months ago probably would have been all the guys that we would have gone to on your behalf if as an insurance broker. If I just go through some of those now, that insurance market has shrunk massively. So for example, MS Amlin have completely pulled out of charity and care. Aviva are very selective, bordering on pulling out, bearing in mind some of the exclusions they're putting in. Zurich Municipal have been very selective on who they take on, and they've actually implemented a COVID exclusion coming on later in the year. Hiscox are putting a hold on any care risks and charitable and care risks that are specific to sort of care delivery. QBE have got a COVID exclusion on their care risks. And travellers are being selective in terms of which risks they're taking on moving forward. So really at the moment, we're looking at sort of two insurers that are actively playing in your segment. So Markel and Liberty are really the only two that are very much open for business and very much offering full cover. What that does mean is those particular insurers have got a full market share, and then they can be quite picky about where they spend their time and attention with their limited resource. So that does have a knock-on effect in terms of what happens in the market. So we can move on to the next one for us, Ollie. This slide was provided to us by one of the major insurers, Allianz, I think second or third biggest insurer in the world. So this talks, and I won't go through every single part of it, but it's just explaining where we are in terms of the market. So we're in what we would call the start of a hard market. So for those of you that aren't insurance experts, that means that premiums are becoming higher and cover will become restricted. So at the very early stages, you can see from the graph that we can clearly see the insurer's capacity, as per my previous slide, has reduced massively. All of those insurers will purchase reinsurance, so they'll have thousands, millions and hundreds of thousands of clients, but they will reinsure some of that risk, so they're not taking all that risk themselves. Those reinsurers, each year they have to renew that contract and that insurance treaty, as it's called. As those insurers go through that renewal process with their reinsurance companies, they will be given increased premiums for their reinsurance, reduced coverage, etc., and that has a knock-on effect further down the chain. So we're very much at the start of this process. However, it's clear to see that insurance premiums are starting to increase. So we've seen some horror stories from people in the sector. We've been busier than ever with clients coming to us saying, what the hell can we do? We've not budgeted for this huge increase that we've been given. So it's very important to get ahead of that. So I'm going to talk to you a little bit more specifically around a couple of liability areas. I think that should be the main focus of your attention for now. And I'm also going to talk to you about some sort of practical tips about how you can help yourself and mitigate a big increase at renewal. So Ollie, if you just want to move on to the next slide for us. So I'm really going to focus on liability. So just to give you some context, business interruption has probably come up lots. You probably all thought about it. It's been in the press. Just as a very quick overview, 99% of you would not have had cover for business interruption pre-COVID anyway. It either wouldn't have been included or there was a specific contagious disease listing, and if it wasn't a disease on that list, you wouldn't have been covered. So in some respects, business interruption is a little bit of something and nothing, as you probably wouldn't have been covered. And more importantly, most, if not all of you, won't have lost income as a direct result of not being able to operate. There's a couple of guys on here that there's a nuance of that, and we know that. But in the main, business interruption won't really have affected you. You might have had some additional costs, but hopefully you've been able to get some grants to cover some of that cost. So I'm really going to focus on liability, and it doesn't matter which specific part of charity and care you're in, this applies to all of you because we're talking about insurance language and terminology. So the three main areas of liability, the first being employer's liability. So this one is actually a requirement by law. So you must have employer's liability. And because of that, the wording and the sort of description of what is employer's liability is very broad. So it's any bodily injury, including death, illness, disease, or nervous shock. So it's very broad, and it's quite clear that if you had a member of staff there that contracted COVID, you guys were negligent and they could prove that you're negligent, cover could and should operate. So from that perspective, it's pretty clear cut, you would think. So if we just move on to the next slide, Ollie. Although it is very clear cut, insurers are very up against it. So what that does mean, and close your ears, Charlotte, is some insurers will look at ways of avoiding to pay a claim. If they're taking huge hits and financially they're up against it, they probably won't be as amenable as they might have been prior to that. So although from your employer's liability perspective, yes, on paper, it should be pretty clear cut, please do be aware that there will have some clauses and some nuances to that. So we put them on there. I don't envisage going through all of those, but there is some expectation here, and it does very much link on with what Charlotte's just spoken to you about, making sure that you put the reasonable protection in for employees. So what all of these are really saying is you can't just rely on, you've got it, we don't have to worry about it. We don't think COVID's an issue, so we're just going to crack on business as usual. That wouldn't wash, and potentially your insurer could look to avoid paying a claim. Is that likely? Probably not. However, you do just have to be aware that that is embedded within your policy wording. And if we just move on to the next slide there, Ollie, this sort of covers that off as well from a health and safety angle. So, for example, if you must carry out a risk assessment that's suitable and sufficient. I'm not going to teach Granny how to suck eggs. I deal with most of you guys that are on this webinar. You're probably much more proficient at risk assessment than I am, and you certainly know your businesses better than we do. So we envisage that you're on top of that. I suppose the key thing to think about, as Charlotte said, is guidance is changing. Not even weekly, it's daily, hourly. So are you do you know the full government guidelines? Are you meeting them as a minimum requirement? Are you acting appropriately and not giving your insurer an opportunity to avoid paying a claim? And I think with the employer's liability side of things, it's very likely there'll be some claims that will start coming in. We've seen some whispers and noises from an employee against their employer for being asked to still come to work and they've contracted COVID. I think it'd be very difficult to prove they caught that as a direct result of being at work. So what will probably happen is there'll be a test case at some point in the next 18 months, and then precedent will be set, and that will be what we'll use in terms of insurance liability for EL. So hopefully it's none of you guys that have that particular issue, but it's just to be aware that's very likely. So it's very important you're taking the relevant precautions. So if you move on to public liability, unfortunately for you guys and even for us, public liability at the moment is clear as mud. So if I just read you a typical example of what an insurer would put as a definition for public liability, it states accidental bodily injury, illness, including death, illness, disease, or nervous shock. So you might think, John, that reads the same as employer's liability, surely we're covered. And to some respect, I might agree with you. However, what about accidental? If you had a service user that contracted COVID, would that be considered as accidental? Could an insurer look to avoid paying a claim because COVID isn't accidental, especially as we move into a second wave? Because they could argue that you knew about it, so therefore you should put greater precautions in place. So we've been stewing on this quite a bit, because a number of insurers are starting to put COVID exclusions in under the public liability. So we've thought to ourselves, does that actually make any difference? Is this a bit something and nothing, a bit like the business interruption? Was they not covering place in the first place? And are they just confirming what was already the case? Or is this a massive shift in terms of cover? So just move to the next slide for me, Ollie. So I don't expect you to be able to read that. It's probably quite small. It's more for a later date. But at the moment, around 80% of insurers that are care and sort of charity insurers are looking to put a COVID exclusion on the PL. So the thing we can be very clear on is if you've got a COVID exclusion on your public liability, they are removing the liability for that insurer to cover you if a service user contracted COVID. So you might think that's very difficult for the service user to prove, and I tend to agree with you. They'd have to prove causation. However, it is a risk, and more importantly, you will incur legal costs to defend that, irrelevant of if it's spurious at best. So we have been speaking with lawyers, we've been speaking with various insurers in their claims department and in the underwriting department. And as of this morning, I've had differing views from even in the same insurer. An underwriter will tell me one view and the claims department will tell me the other. So it's not very clear. We put an example here of one insurer that was still offering cover, but again, it states accidental injury. So it's very much around what is accidental injury. So I think in the same regard as employer's liability, what will happen will be there will be a public liability claim and precedent will be set by law, and then that will be the sort of way to go. So what should you do in the short term is really understanding what your policy wording says. So this is just one example. All insurers are different. So Markel actually probably have one of the widest wordings, and they do clearly cover. And we've confirmed with them they would pick up something like this and the legal costs. Whether or not that will change in the future, who knows? But if there is a COVID exclusion put on your policy at renewal, that is factual. You would not have any cover for any COVID claims that arose for public liability. So if I think of an example of a domiciliary carers, for example, service user contracts COVID, they have been shielding. They then claim that the only way they could have contracted COVID was the carer came in to deliver care, and then will then sue the organisation for them catching COVID. That's an example, and I expect that each and every one of you on this call today could think of an example of a similar nature. So it's really important to understand what your insurer is offering in the moment and what they might look to do in the future. The best thing definitely to do is try and avoid a COVID exclusion in the short term to give you the best and possible chance and the widest cover. So just move to the next slide, Ollie. So this is an example that we've received, and I've anonymised it, not said which insurer it is, from one insurer that we got this week. Very, very late in the day, which we weren't particularly impressed with. We'd even flagged with a particular insurer in the pre-renewal meeting, are you going to put any COVID exclusions in? They said, absolutely not. And then 6 weeks before renewal, we received an email which confirmed this. So they're looking to put a COVID exclusion in. Then they're stating the reason being is it's been applied across the insurance industry, which we have particularly pushed back on as it's not for everyone. So I think that's a bit vague. Secondly, and most importantly, they've looked to hold on the fact that their long-term agreement with this particular client hasn't changed. So they're saying that basically the client will have to suck it up, and it's still within their contracted agreement. We have severely pushed back on that, and then the insurers backtracked and said, actually, yes, we do agree now that it is a big change. So I suppose the point to make on this slide is when insurers are up against it, they will try it on, and they will try and mitigate and reduce their cover as much as possible, as well as putting the premium up. So it's really, really important you get ahead of that as soon as possible. Just move on for us, Ollie, to the next one. So this just talks about really just what's happening. So in terms of employers' liability, we're seeing some insurers refuse cover, increase cost, or reduce limits, or a mixture of all three. In the public liability, they're relying on the word accidental to try and avoid paying a claim, changing cover for the abuse side of things to a claims made, which reduces cover and sort of the long-term cover, excluding COVID, increased excesses, reducing to cover, increasing the cost and reducing limits, or a mixture of all of them. So there's lots going on there in that insurance sector, and there has been whispers that the government are going to look to create a pandemic re, which is a bit like Paul Re to cover terrorism. It's far too early stages, and the government, I don't think, have got the resources or the time at the moment to come up with something yet. So at the moment, it's really important you understand what your cover offers you and what your insurer at the moment are looking to do with your cover. Are they looking to change that and get ahead of that curve? So we've just moved on to the next one, Ollie. And then the third angle in terms of indemnity is to think about your directors and officers or trustee indemnity. So I think the thing for here is to point out that directors and officers cover does not cover personal injury. So if there was a COVID outbreak, it wouldn't cover the personal liability for a member of staff or a member of the public, but it may include some defence for any corporate manslaughter prosecution. So that's pretty far in, and hopefully would never come up. But we are seeing the directors and officers world, insurers being very picky about which risks they take on. They're looking to only take on risks that are profitable. If you're making a loss, they're making it very difficult, or putting insolvency clauses in there to protect themselves. So it's really important to I would say for your directors and officers insurance, that should be the first thing you look at renewal, and do that really early, probably much earlier than you normally would. So we just move on to the next slide, Ollie. So as I said, they're excluding insolvency, they're reducing limits. We've had examples where clients have had 10 or 5 million, they're only offering 1 million, reducing discovery periods to mitigate the cover, increasing costs, or even in some cases just refusing to renew because they're pulling out those particular segments. Charity and care especially are high on the list of risky areas, and unfortunately everyone gets thrown in the same box when we say charity and care. So I think if you've got home care and residential care, where you will be seeing the greater risk, especially for sort of care homes, everyone else gets thrown into the same mix, which we don't feel is particularly fair. However, that's what insurers are doing from a sort of global and UK level. So we just move on, Ollie. So what I really want us to do is just spend 5 or 10 minutes just going through, okay, those are the issues. I've scared you to death a bit, thinking your premium's going to go up, the cover's going to be reduced. Jesus Christ, what can we do? So we're just going to talk through now some of the things you can do to help yourselves here. So I think the most important thing is how you present your risk. So many of you guys are very, very busy. Insurance is probably tagged upon your job. You're not a risk and insurance expert, nor do you want to be. It's something that's landed on your desk, probably not out of choice in many cases. But spending that little bit of extra time or working with your broker or advisor to make sure that you present your risk in the best possible way could not be more important, especially in the next 12 to 18 months. So some of the things that you might want to think about, and it does have a direct correlation with some of the areas that Charlotte's spoken about previously. So share your specific COVID-19 plan. So what have you actioned so far? What was your strategy? What's worked well? What hasn't worked well? What are you going to do differently? Give that insurer, the underwriter, peace of mind you're a good risk. Every single client I've got can articulate that to me over the phone or in an email. Can they give me something in writing which I can share with an underwriter? Not many clients can do that at the moment, is my honest answer. But that really differentiates you from another risk and gives your broker or advisor the best possible chance of getting you the best possible premium at renewal and avoiding big increases. So yes, it might take up a bit of time, but I think it also has other benefits elsewhere. So I think you're going to start seeing from commissioners, they're going to ask for that kind of information anyway. So it's going to help you in winning new business, retaining existing contracts. So it is something I think you'll need to think about regardless, but making sure you don't forget to share that with your insurance advisor. Charlotte touched upon training. So it's all well and good doing training, but from a liability perspective, if you can't evidence they were at the training and they've signed to say they've been there, it's not really worth the paper it's written on, and unfortunately you wouldn't be able to defend a claim on that basis. So a simple thing like a centrally held or a service held training matrix makes all the difference, and that can be the difference between defending a claim or not. But it also again gives the underwriter peace of mind that you're a good risk. Evidence of updated and signed care plans. All of you guys that are on at the moment that are my clients, I know full well you have individual care plans or risk assessments for each of your service users. However, have you updated those as a result of COVID? Are they really as up to date as possible? What's the process for sharing that with your staff to make sure they're up to speed as possible? So I'm jumping down a little there, but use of technology. So for example, I know some of our domiciliary care clients use tech tool called MyBizio, powered by Access, which has real-time care updates. The member of staff can see the up-to-date care plan on their handheld device at a touch of a button. Being able to evidence that obviously shows you're a much better risk than another risk that hasn't got that. Just moving back up to risk assessments. So again, following on from the care plans, really, have you got a template for each service? We've got some that Charlotte and I have worked on in the last couple of months that are on our website, which I'm happy to share the link. Might help you stop having to reinvent the wheel. You're happy for you to use them, doctor them, and change them to suit. Also, I think some areas that clients often forget is wax lyrical about the staff you've got. So many of you have got great health and safety teams, great risk teams. How good are they? What do they do? What do you do that you think makes you a great risk? So, for example, if you've just employed someone new and they're really great, they've worked for some big blue chip companies, they've got some great ideas, let's share that information with the insurer because it shows what a good risk you are compared to Joe Blogg's risk up the road. So Charlotte mentioned about claims defensibility. What are you doing to improve your claims defensibility? For example, does your broker supply you with claims defensibility training? Have you done something internally to do that? Do your managers know what information is required to try and defend a claim? Yes, they're probably juggling quite a bit at the moment, but even if it's a document or it's mentioned in a sort of management meeting, to get that on their agenda. Again, things like that do make a huge difference when it comes to an underwriter giving you your premium and cover for the forthcoming year. So moving on from that, what sort of claims data do you get? So many of the clients that we're seeing coming through to us haven't particularly got great data. It can be quite high level. What do you do with that data? How do you use that claims data to make sure you improve? So it's all well and good having a claim coming through, you've defended it or had to admit liability. What do you do with that information? Are you sharing that with everyone? Are you sharing why you could defend it or why you had to admit defeat? So then everyone else understands what to learn from that particular claim. Often I see that's not the case, and that loop is not always closed up. And taking that even further down, do you articulate your repudiation rate, or does your broker articulate your repudiation rates? So you might have a number of incidents. A lot of you guys here work in particularly risky segments. You're going to have incidents regularly, but what's the percentage of those that turn into a claim? And more importantly, what's the percentage of those claims that are defended? Many of you will have a really high repudiation rate. So if we can articulate that to an underwriter to show you might have 20 incidents a year, you only have one claim and you normally defend 80% of those claims, it gives a very strong message and it gives the underwriter peace of mind. So I think all through all of those is a common theme. It's very much about evidence. Will it be a little bit more labour intensive and a little bit more information you need to provide at renewal? Most definitely. If your broker understands your organisation, a lot of that might already be done, but it's really important to make sure you get the best possible terms and, more importantly, avoid any cover changes. So we've just moved to the next slide, Ollie. So what you should have, and any of the guys on here that are clients of innovation, you'll have a document like this, which we call the presentation of risk. So this has all the sort of background information on yourself as a client, all the financials, all the cover details, but more importantly, this should be able to articulate everything about you as a risk, why you're a good risk, and really get into specifics. So it's really important to make sure that document is up to date as possible and waxes lyrical about how good you are as a risk. So if you're not with innovation, it might be worth just testing your broker to see what they've got and what they share with your insurers, and making sure that's as up to date as possible, and sharing the best possible story. Just move on to the next one, Ollie. So I'm just going to finalise down. I know it's been quite a whistle-stop tour, but I just wanted to focus on a couple of key things rather than bombard you with lots of jargon. So I think the 5 key things I would say to take away is prepare packs to demonstrate how you're handling or have handled risk assessment and COVID. So what have you done? What are you going to do? What's your strategy? Have you got a document you can lay your hands on and you can share with your insurance advisor to pass on to your insurance company? That's more important than ever now. So for some insurers, it'll be a requirement and they won't even offer you cover if you haven't got that. Be prepared to be asked for census detail around COVID. Just giving a quite woolly, approximate bit of information is probably not going to fly as you get through to renewal. So really, let's look at the detail. And I think actually that will probably help you. If you can articulate, especially, for example, some of our domiciliary care clients, you're thrown into the mix and the same as a residential care client. If you can evidence actually the amount of staff you've had off has been considerably less than you planned for and considerably less than other segments. I mean, I know for a fact that in dom care, actually, it's probably the same sort of drop-off rate as office staff and sort of more standard risks. So can you articulate that and share that with your insurer? Keep talking with your insurance advisor. Fortunately or unfortunately, some might say I think you are going to need to talk to your insurance advisor, and they're probably going to have to earn their coin a little bit more than they have done in the past, and let them articulate to you what's coming down the line. So sessions like this we hold very regularly, and we put plenty of content on our website because it is ever changing. Some insurers will change their stance on a weekly, hourly basis, we're seeing. So it is a very ever changing beast. engage in your renewal really early. So I know providing renewal information is a pain in the proverbial, and you probably get peeved that you're asked for a lot of information and a lot of things haven't really changed from the previous year. Unfortunately, in the next 12 to 18 months, I would try and plan and set aside some time to try and do that as early as possible to avoid any unnecessary surprises. And then finally, off the back of that, is making sure, so just go back one, Ollie, for me just a second, is just to brief your board or trustees or relevant people on your financial projections. So are you aware and have you budgeted for a potential increase? So depending on what sector you're in, what your claimed experience is looking like, talk with your insurance advisor to make sure you understand where you're at the moment, so you don't have any issues when it comes around to your insurance renewal and you've under budgeted, for example, and then it can cause some financial worry or concern. Cool. Okay, so that was everything I wanted to cover off in terms of insurance. As I said, we will send these slides out to everyone, and we'll also have recorded this session, so we'll send a copy of the recording. And as I mentioned at the outset, Roger was unable to attend today, but I interviewed Roger earlier in the week and have got that particular session as well. So we'll send you both recordings and these slides. And I think Charlotte's got a couple of documents she was going to share as well, which you might find useful. And we have got about 15, 20 minutes left. And I just wondered if there's any questions that anyone wanted to ask. Happy if you want to type it in the box, or if you wanted Ollie to unmute you, we can hear that from you firsthand. Has anyone got any particular questions they wanted to ask? Deathly silence. We scared you all to death. Even Lisa, you haven't got any questions for us? We must have scared you. Okay, so I won't take up much more of your time. If you have got any questions you think of later, please do drop us a line. I'm more than happy to help. I think what I'll just spend a couple of minutes doing is just giving you, oh, here we go, we have got a question. We are a school, how specific can you be when it comes to refunds due to COVID-19? So Harriet, sorry, Ollie, can you just unmute Harriet and just Harriet, if you want to explain exactly a bit more specifically what you mean by that, and we'll hopefully be able to answer that for you. Ollie, can we just unmute Harriet? Oh, there we go.
Can you hear me?
Yes.
Oh, hi. Sorry, yeah, just to explain a bit better. So we're a school and we have sort of fee-paying students. And we have sort of two sides to what we do. We have sort of an academic side where, we're running 3-year-long courses. And then we also have public courses where people might come for an evening or for a sort of series of 10 classes or something. If somebody were to get sick, not necessarily just get sick, but to need to self-isolate due to COVID, partway through a course, how specific can we be when it comes to, we obviously need to develop terms and conditions around that. I mean, would we need to be refunding students in those circumstances, or, I mean, how do we approach that?
Okay, so it's probably two elements. So from an insurance angle, your business interruption cover, you either won't have it at all now, or you won't ever be able to get it moving forward. So I think it's safe to say your insurance policy, unfortunately, wouldn't respond. Most insurers wouldn't have responded previously anyway. I know you guys pretty well, so there's sort of potential issues we've had there anyway. In terms of from a business perspective, that's down to your T's and C's really. So you are legally able to do that and say that once you paid your sort of enrolment, that's it. If you're off sick, the same way as if you're off sick with anything else in the past. So I don't think there's any legal guidance around that, Charlotte. Correct me if I'm wrong, but I don't think so at the moment. Obviously, you just need to consider the reputational angle there. If suddenly you had a lot of people off sick and you're not going to offer them a refund, but you've got to balance that with you need to keep the doors open and pay people's salaries and keep the lights on. So Charlotte, I don't know if you had anything to add to that.
Yeah, so we have seen this. So one of the issues is at what point that they take out those T's and C's. So, for example, if you're updating but they booked it way in advance, have you got a clause that lets you update your T's and C's during that period? We've seen other people say, for example, okay, so you couldn't do half the course, so we will give you a part of the course another time it runs. So it's looking at, I suppose for me, that there's multiple issues. It's lost revenue for you guys, but it's a reputational issue as well.
Right.
And you don't want people to be doing it. Again, that's where I talk about fear and anxiety. People might not do something. For example, we run training courses. The amount we've had cancelled is unprecedented. But we get cancelled the day before. We can't re-put that in, and we lose that revenue if we don't undertake it. So then we've got to think, okay, so if we say you have to cancel this much in advance, because actually we need that fiscally, or the opposite thing is, if you let loads of people, reputationally, does it benefit you? So that's where you look at the cross analysis and that critical thinking. Okay, how often is this likely to happen? Is this being done with fear? Are we going to ask people to deliver some proof, i.e., are you isolated for this reason? Why can't you attend? And how much can you have that discussion? So, for example, if you're doing it for somebody who's a big provider and they've got 25 places, you're not really going to make a fuss because you lose the other 24.
Okay.
So it's for me, and that's where I talk about, and I suppose this really helps, Harriet, because that's where I talk about scenario testing. So when I do that with clients, I'm looking from the A, B, and C of the scenario and saying, well, if we took this line where we didn't give a refund, what's the worst case scenario and the best case scenario? If we did, what's the worst case, best case scenario? Personally, I'd be saying what I've seen is if you're part way through, it's at your discretion. If you cancel within 2 weeks of it starting, different.
Okay.
But it's really setting that precedent. And again, it's been really clear. An outside of sector example is, for example, the hotels did exactly the same process. As soon as it hit, if it was in the real big part of the lockdown, some said, look, we'll let you rebook later in the year, but you can't get your money back. It's a very simple process. And then it's been really clear. And like most of COVID, it's about your policy as an organisation. Doesn't matter what Bob's doing down the road, it's you and what's the reputational, business, fiscal damage. So that's that real cost analysis.
Brilliant. Thank you very much. That's helpful. Thank you.
Thanks, Charlotte. I hope we managed to answer your questions as best we could there, Harriet.
You did. Thank you very much.
Great. Has anyone else got any questions before I sort of move to summarising and let you guys get on? Any particular burning questions? Okay, great. So I'm just going to spend a couple of minutes just summarising some of the key points, because it's probably been through quite a bit. You probably think, Jesus, have I taken all that in? So I think just summarising some of the key points I took from Charlotte's particular session, which does link over to mine as well, I think. So evaluate your initial response. What went well? What are you going to do differently? How are you going to plan for this second wave? Following on from that, the government guidelines are changing daily. How are you keeping up to date with that? Have you got someone in particular that's their responsibility? How do you know you're meeting those government guidelines? And I think the key thing to think there is those government guidelines are very broad stroke, and they're a minimum, not a maximum. So just being able to articulate, yes, we meet the government guidelines, is just a minimum. That doesn't mean you're a fantastic risk, with all due respect. That just means you're meeting the government's minimum requirements. If you really want to get the best premium, for example, get the best cover, really impress your commissioners, you're going to have to probably do a bit more than that. Crisis planning versus a proactive BCP. So first wave, we no one knew it was coming. I think even when it was actually in the thing, none of us really believed it or thought we were in it. Now we very much know what we're dealing with to some respect, and we know that there's very likely we're going to hit a second wave. We might argue with some of the stuff that goes on in the media, but I think it's safe to say we're going to enter a second lockdown at some point. So have you got a proactive plan? Have you got a decision-making tree? Have you articulated that with key personnel so they know who to speak with and when, if it hits the fan and you're in trouble? I think one of the areas that Charlotte picked up on was around staff wellbeing. We're in that bit in between, that little lull between the second wave. I've spoken with a number of clients who are starting to think about what they can do to support clients. Some have even had grants. I know some of you in the home care space have got some ICP grants, which you can't always use solely for PPE. So we've helped some clients be quite creative with those using for staff wellbeing. So things like, for example, employee assistance helplines for counselling services, or we've even got some clients that signed up for some online GP services, which have been quite useful. But obviously has a double benefit in terms of your staff can't get appointments to their doctors face to face. So if you enable them to get an online appointment instantly, you can improve the sort of sickness and people off. And suddenly some of those people that might have asthma might not have asthma and they stay at work or still come to work. A couple of other things that I picked up on was having your difficult conversations with your commissioners early. So if you've got some contracts due for renewal or you're looking to bid for a new contract, have those conversations nice and early. I have seen some clients that they're due to have a contract that goes out for tender, and they've actually renewed that in advance because the local authority hasn't got the time, the resource, and they're concerned about what that would do if they look to move that. So especially the contracts you want to keep, perhaps where they're paying on a whole service delivery rather than a sort of allotted hours or time, you want as many of those contracts as possible locked down for financial security. The session that Roger recorded earlier in the week will go into much more detail around that, especially if you're in the home care world. We've got some real top tips there and some thoughts you might want to think about. One of the other things there from Charlotte's session was disclaimers aren't really worth the paper they're written on, especially if we're talking about shielding. So I've seen a lot of clients just say, well, if I give them agree with Charlotte, if we just give them a form to say, yeah, I'm happy to take that risk and we come back, unfortunately, that wouldn't wash in a course of law. And the onus is on you guys as employers to look after your staff. So unfortunately, and I think I always take the stance, if you're thinking about double thinking yourself whether they should be on or not, I'd probably err on the side of caution. Granted, there was a financial element to that, but look at the numbers, think, can you deal with that and work accordingly? And in terms of the insurance side of things, I think a couple of things there that I really wanted to get across is make sure you can evidence what you've done, make sure you can evidence why you're a better risk than someone else that's also in your field. And it's really important to understand the landscape in your particular niche of the charity and care world. I suppose overall, unfortunately, whether we like it or not, we are moving into a hard market. So there is going to be cases where some of your guys' premiums do increase, the cover is going to be reduced. It's really important that you engage with your insurance broker nice and early and make sure they're having the right conversations with insurers. So it might mean you have to move insurers. It might mean you have to be a little bit more assertive with insurers to get the right result. So it's really important you do that. So I think those were the key messages that I picked up on. We've still got a couple of minutes left. So if anyone has got a burning question, please do shout now or forget ever hold your peace. Okay, great. So I'm going to give you back. Oh, hello. We've got one more session. Yeah, no, thank you, Anna. Yeah, no problem. You're most welcome. We'll get those slides sent across hopefully tomorrow. So thank you very much, guys. I'm going to give you 6 minutes back, so I'm sure you'll all enjoy it. And make sure the recording is sent out at the very latest early next week, and we'll send the slides as well. So thank you very much for your time, and look forward to speaking to you soon. Take care.